So, All-on-4, having a full mouth of dental implants, teeth in a day. What an amazing treatment. You can go from having a completely hopeless smile to having a great set of temporaries all in one treatment session. All of your dental problems gone in one day. Why would we ever want to do it any differently? Why would we want to prolong the process? Why would we go through an awkward phase of dentures if we don't have to? So in this video, I want to explore the advantages and disadvantages of doing things in a more classical fashion. When I say classical fashion, I mean taking teeth out, waiting, letting things heal, and then having our implants placed. So my name's Gus. I'm a cosmetic and implant dentist. We've been doing this, helping our patients with complex dental problems for over 10 years. And the vast majority of what we call full arch implant treatment is done in one day. But recently, I've seen about 4 or 5 patients where we've kind of had to do it in a staged way, which is what we're going to explore today. And there are a couple of really key advantages which I feel are important, and if I was going down this route of having this treatment, maybe I would explore the idea of doing it in a staged way. So let me just explain the two differences quickly. With All-on-4, we've got a situation where we've got a hopeless set of teeth. They're infected either with gum disease or they're all broken down, and what we need to do is rebuild a smile. So we're able to remove all the bad teeth, remove the vast majority of the infected gums and bone, but we'll come back to that in a bit, and place our dental implants and have a set of temporary teeth fixed on the day. The main advantage of this treatment is that everything is done in one day. When I say everything, I mean all the surgical stuff. Anybody who's done any kind of research into this will know that the whole process can take 6, 9, even 12 months. But the messy, uncomfortable stuff is done in one day. Now, the alternative is that we remove the teeth and maybe do some additional treatment, which I'll talk about in a second, in session 1, okay? And then the patient would leave with a removable denture, okay? That one thing that people always seem to hate or not really want, okay? But that is how we would temporize the smile. And then we let the gums heal. And then we come back about 3 months later, and then we can place our implants, and we can either put the temporary teeth on the implants on that day or we can wait. But in this video, I'm going to assume that we're putting the temporary teeth on the day of putting the implants in, okay? Technically speaking, what we're talking about is immediate versus delayed placement of the implants. And I feel there are a couple of key advantages to doing this treatment in this way, as well as the very obvious disadvantage of doing the treatment in this way. Now, as a clinician, with my face, my name on the practice, I'm really interested in the long-term success of our patients. If we do a treatment, if our patients put in a massive amount of trust with us, I want to be 100% sure that we've got every base covered. Okay, it doesn't always happen, but we like to do everything to stack the odds in our favor. And one thing that we know really helps with the long-term success rate of dental implants is the quality of gum around the implants. So here's a photo of a recent case we did with All-on-4 treatment. And you can see what I mean here, right? If you look at the thickness of gum on the outside, so this is the top set of teeth, and on the inside we've got the roof of our mouth, okay? We call it the palate. The palate has very tight, strong gum, okay? We call it keratinized gum. And what we want to have is keratinized gum all the way around the implants. And I see this all the time on social media, on WhatsApp groups, where implants are placed a little bit too far out, and we end up having this thin gum, the gum which we find on the inside of our cheek, covering half of the implant. Now, this was fine. That implant is going to integrate. Everything is going to work great for especially the short term, but we know that the long-term success of that implant is compromised. So if we look at just a general set of teeth here, you can see that we've got this zone of this keratinized tissue along the teeth. Now, in some situations where somebody is thinking about having an All-on-4, they've lost a lot of gum height, and this zone can become extremely thin and almost non-existent in certain places around the arch. Typically, the canine teeth, where the gum is naturally higher, has less keratinized gum around it. So if we're doing All-on-4, it becomes tricky. Okay, it's another challenge that we need to overcome, and I'll talk about more challenges as this video goes along. But we need to think, okay, as we close the gum up, how are we going to maintain this thick gum? So if we look at a situation where we've got no teeth to begin with, what we can do is, imagine we want our implants in these positions. We can actually take a little bit of the gum from the roof of the mouth, remember that good strong gum, we can fold it under itself almost and have it on the outside of the implants, and then we'll just stitch everything in place, and we've got a natural kind of connective tissue graft. Well, it's not natural, we're kind of influencing it, but we know that we've got blood supply from the outside. This is going to support our gum graft, our tissue graft, and the gums are going to heal really nicely. And if you look a few weeks later, you can see what I mean. You can see that these implants have this really thick collar of keratinized gum around them. Now, if we look at All-on-4, if we were going to do All-on-4 for this patient, which is, we didn't do All-on-4, but just as an example, we've got this red inflamed gum. Okay, it's really, really obvious. Now, if we were going to remove the infection, we are going to excise the infection. That just means cut it out. Okay, so a part of the All-on-4 process is you cut a level of bone. That's to get rid of infected bone. And also we cut away a little bit of the gum, again, removing all that inflamed gum. Now, the inflamed gum is keratinized gum, so that zone of keratinized tissue that we've got, we're actually removing it a little bit in order to have successful dental implant placements. Now, in the vast majority of cases, we do get some keratinized tissue around all of our implants, okay? But not every single case. And we don't get as much as if we had taken all of the teeth out, let the gums heal, and do it in a delayed fashion. But the truth is, as a patient, literally 0 of my patients over the last 10 years have ever complained about this. Okay, this is not something that any patient is ever going to notice. It's more, as I say, a thing which can affect our long-term success of the implants. Okay, so in the long term, as implants start to fail, we don't know why they failed maybe, but there's a good chance it could be because that the gum quality at the outset wasn't as good as it could have been. Another reason to maybe consider a delayed option is that your treatment sessions are going to be shorter. Some people actually don't like being in a dental chair for 6-7 hours. I don't know why, but if we were going to, say, just do the extractions, remove all of the teeth and fit a removable denture, then we could actually do all of that in maybe an hour. And then when it comes to the implant placement, take maybe 2 hours, 3 hours max, okay, to place our dental implants, and it becomes an easier surgical procedure. I'll explain that later. But for some people, these shorter appointments work better. Even though we have more surgical appointments, the kind of the duration, the kind of the stress, it is awkward sitting in a still position for such a long period of time, especially if you're anxious. All your muscles are going to feel tight. I mean, when I have a hygiene session, sometimes my muscles feel tight and I have to force myself just to relax. So this could be considered an advantage. The next advantage is that we have an opportunity to do something called socket preservation. So socket preservation is a technique where when you remove a tooth, you can put something in that socket to help support the bone. So if you watch my other videos, you might already know this, but when you remove a tooth, the bone is going to shrink around that tooth, okay? There's no reason for that bone to be there anymore because it was there to support the tooth. So as you remove the tooth, we lose thickness, okay, the bone comes in a little bit, and we lose a little bit of height, okay, depending on how many teeth we've taken out next to each other. If you're just missing one tooth, this is really obvious. You can rub your finger over the gum and you'll feel it kind of sink in where that tooth has been removed. Now, what socket preservation does, we put either bone grafting materials, or we can use PRF, which is something I'll talk about in another video. These are things that we can put in to help support the bone and and reduce that bone loss. Okay, we're not going to get rid of it completely, but we have the opportunity to reduce it. Now, you could say that we can do this during an all-on-4 treatment. We take the teeth out, we've got that socket there, couldn't we just fill it up with bone graft material? And the answer is yes, we can. Sometimes we do. I personally don't like doing it too much because it adds an extra layer of complexity, especially if we're using bone graft material which is not from that patient. As soon as a little bit of that was to get infected, we've suddenly lost the whole graft and probably the implants that were touching that graft. Okay, so we do the grafting, but it does incorporate this extra element of risk. Now, if we were going to do this in a staged approach, we remove all of the teeth, and as this socket heals, because it's surrounded by this thick keratinized gum, it fills up with keratinized gum over the top. So the next advantage is that the actual implant placement surgery becomes a lot easier. Now you might think, hey, I'm paying for this, I don't really care how easy it is. But if you can have an easier treatment, it will improve your long-term outcome. It will improve the end result of the treatment for yourself. So let me explain why it is easier. We've already talked about the gum, okay, so that's makes a massive difference. The next thing is, if you imagine we've got this scenario where we've got all of these teeth that need to be removed, we take the teeth out, we now need to make another hole in the bone for the implant to go through, and then we have to engage this implant in much less bone because, you know, we've got these massive holes where the teeth came out of. If we let everything heal, these sockets are going to fill up with bone. Okay, now granted, it's not going to be really strong bone for about 9 months or so, but it's reasonable bone after 3 months. So having a situation where you've got much more bone to engage your implant in makes life a lot easier from a clinical point of view. Over the years, we have had situations where we're planning to do an all-on-4, we start drilling, we take out the bad teeth, we start putting the implant in, and a section of the bone just cracks. Okay, immediately you can't do much in a situation like that, and it's cracked because it's fragile. So waiting a bit of time reduces this complexity and just makes it a lot easier for the treatment. And if the treatment is easy, it's going to take less time. So that's it for the surgical advantages. Okay, I realize that most of this has been to make my life easier, but there are what we call prosthetic advantages as well. Okay, and prosthetic just means the look of the teeth. If we take out all of your teeth and we give you a removable denture to wear, then you have the opportunity to have multiple try-in appointments. Okay, if we're going to do an all-on-4 for someone and go from here to here and do it all in one day, I'm kind of guessing in my head where the teeth should be. And it's usually a decent guess, but it is a guess. Whereas if somebody comes in and they've got no teeth at all, then we can try in different length of teeth, different width of smile, and we can get a much better idea of what the end result is going to be like even before we've put the implants in, because the implant position is always guided by the position of the final teeth. So taking all of these advantages into account, the goal of treatment is always to give our patients the most predictable end result. And this is why we use so many additional minor treatments like the PRF, which I've spoken about. Okay, it's not essential, but it just improves wound healing, it improves the end result a little bit. Like the old adage says, slow and steady wins the race. Okay, so there are advantages in certain situations where we would advocate, look, let's just remove the teeth, let's let it heal and then come back to it. I mean, this is something I almost always do for any patient who needs zygomatic implants. So sometimes we are forced to look at doing things in a delayed fashion. Sometimes thinking out of the box can really help us achieve that end result. If you look at this case, this person needed all-on-4, but we've got these massive infections in the bone, and the bone almost looks like Swiss cheese. There's no way that I can confidently say that we can put in implants here and they'll be tight enough to fit a set of teeth on the implants. So what we did in this case was we kept a couple of teeth and we put implants right at the back, okay, because we had good quality bone there. So appointment 1 was 2 implants going in, removing all of the bad teeth and keeping a couple just to support a temporary bridge. So no dentures, but we had all the advantages of letting the bone heal, letting the gums heal, and having that good quality gum around our implants. So 3-4 months later, yeah, we had a couple of breakages in the temporary bridge once or twice, but we were able to put in the additional implants near the front and use those back implants, which had now integrated, and we were able to put a temporary bridge on the implants in 1 session. And then from then we just wait 6 months and then we make our final bridge. So it doesn't mean that we always have to go to a denture. It is very case dependent. But I'm just saying dentures in this video just to prepare yourself for the worst situation. Alright, so let's talk about the massive disadvantage, which for a lot of people is a really big deal, and this is having to wear a removable denture for a period of time. Okay, typically 3 to 4 months, but in your mind maybe push it to 6 months. Now the denture will look good, okay, it can be made to look really nice, but it's the fact that it's loose and some people have a gag reflex. So what can we do in these situations? Well, it's possible that we could place a single implant maybe in the roof of the mouth, okay? And the advantage of this is we can use that to click in a removable denture. That immediately makes it a little bit tighter and a little bit less uncomfortable. And if you've got something to click into, it doesn't need to extend so far back. Okay, so this is one possible way around it. What we find is a lot of people are absolutely fine just using that denture adhesive, the glue. It's really messy, it's horrible to use, it's horrible to take off, but it gets us through this period of when we've got no other choice. The other disadvantage is that it's more visits, okay? I know that some of our patients travel 3-4 hours to come and see us, so there's a bit of a pressure to kind of get everything done in one go for these patients, and that would almost leave the delayed option off the table, just purely because of the distance. Now these days I do offer it as an option and our patients can make the ultimate decision. For some people 4 hours isn't a big journey, to be honest. If I wasn't working, I would love to drive for 3-4 hours. It's not a big deal for me, but for some people it is a big deal, and this can help weigh up which kind of treatment option is better for you. Ultimately it always comes down to the short-term gain and the long-term gain. What are you willing to give up in the short term to get a better long-term end result? Now everybody's different and everybody has different priorities in their treatment end results, but also the process of going through this treatment. This is why All-on-4 is such a popular treatment. A lot of people just want everything said and done, and they're less concerned about the long term. But the point of this video isn't really to talk you into having something in a delayed way or having something done in an immediate fashion. It's more about just to open your eyes and open your mind to the different possibilities. If you're in a situation where you've got no teeth or your teeth are hopeless, try not to get sucked into the idea of All-on-4 and everything's fixed in a day, because the clinicians especially who I know, who are providing this treatment for their patients, they are really thinking about the quality of gum. They are thinking about, actually, you know what, I've got this situation, what's the best way? They're not thinking, oh, I've got this one product, this one treatment that I can offer my patients, so everybody has to fall into that treatment. And you know what, if you see a really ethical dentist for your situation, then maybe there is another option other than All-on-4, right? I truly think that All-on-4 is overprescribed and people are taking out too many teeth just to fit in dentures, just for a quick fix almost. In certain situations, it is definitely the right thing to do, but not in every single situation. So I think that really it's important that you look at all of your options and your different stages, different ways of carrying out this treatment, and figure out what works best for you. So if you've got something out of this video, if you found it useful, please give it a thumbs up. Things like that really help it to be found by other people in your situation. So thanks for watching. I will see you in the next one. Take care.